EMS has been dispatched to the home of a 72-year-old woman with shortness of breath. She is a frequent flyer. We've seen this address a few times. Woman lives alone, has emphysema, hypertension, and normally refuses EMS transport. EMS arrives on scene, enters the patient's house, and smells cigarette smoke with many full ashtrays in the living room. Patient is sitting on the edge of the couch. She's wearing a nasal cannula attached to home oxygen and is smoking a cigarette and is experiencing obviously breathing difficulty. She speaks in two-word sentences that her shortness of breath has worsened. As EMTs, we arrive on the scene. We have our personal protection equipment on, and our body substance isolation is ready. The scene is not safe. The woman's sitting on the couch with oxygen and smoking a cigarette. So we are going to ask her to put that out, and maybe her son there can help her. Once that is done, her nature of injury is labored breathing. She's one patient. We don't need additional resources at this point and no need for spinal immobilization. All right, our general impression is the woman is definitely sitting there, is laboring. She's in her 70s, 75, 78, white. Appears to be fairly distressed having to breathe. The environment is not very good. She's a heavy smoker with ashtrays all over the house. Her mental status, she is alert and awake as best she can be for breathing so hard. And her chief complaint is that she has this labored breathing and it's closing in on her. It is somewhat restricted, but looking in her mouth, it's not obstructed by anything, any object. It's just due to her COPD or what is open enough to continue on. She is breathing, but then again, very labored, and she can only speak in two-word sentences in between breaths. She's kind of got clammy skin, some cyanosis happening, so very bad perfusion coming through. Taking her pulse, it's on the weak side also. I think with her labor breathing, she's having a hard time perfusing, and we'll work our way to get a pulse ox on. We are going to transport her, so as we're getting that ready to go, we're going to do a further, more focused evaluation, and we'll get vital. So we're going to see if we can get a blood glucose. Then we'll move, get that pulse ox going, and we'll check her radial pulse again and note that. Her skin again is clammy and blue. And we'll take a blood pressure, and that appears to be on the low side. And we're going to listen with the stethoscope to her breath sounds. I can definitely hear some wheezing in and out with her on both sides, and very short intake, long out exhale. Eyes, her pupils are dilated. They have tracked me since we've been in, and they are the same size. We asked her what brought this on. She doesn't know. She's just been sitting in her chair all day, so nothing provoked it. It's very labored, so and there's no other areas besides her chest, and it is pretty severe. Not pain, but just how heavy she has to breathe. And this particular episode started about 15 minutes ago. So other history to get from her, any other signs and symptoms with this, any known allergies does she have to any medications or anything like that, what medications is she taking, and any other past medical history that would be pertinent now. When was the last time she took any of her medications, and were there any events? She just said she was sitting there and all day. There's no other need for any trauma examinations, but I'll just take a look around head, neck, the chest, abdomen, make sure there's no pain there, pelvis, posterior, and the extremities. Very low perfusion on the end of her fingers. She can feel the end of her fingers and feet. So we've decided prior to get her loaded up, we're going to give her a dose of albuterol. So we're going to give her 2.5 milligrams diluted in 3 milliliters of normal saline. Nasally, or inhaled, sorry. We give her this albuterol. We have the right patient, 78-year-old female with respiratory issues. Checked the vial. We have both saline that's not expired and the albuterol that's not expired, and it's the right color. Give the dose, the 2.5 milligrams for 3 milliliters of saline. It's going to be through an inhaler, so through the mouth inhaler. The time is 6:32 p.m. and all this information will be documented. And then we will load and go and repeat vitals along the way with repeat the primary assessment, secondary assessment, reevaluate our interventions, and repeat vitals.